Did you know that erectile dysfunction affects nearly 45% of men over 40, yet most never talk about it? Doctors call it the silent epidemic because shame and stigma keep millions of men from seeking help. But here's the truth. Erectile dysfunction is not just about sex. It's a warning sign, often pointing to deeper health problems like diabetes, high blood pressure, obesity, depression, and heart disease. In this video, we'll uncover the real causes and risk factors of erectile dysfunction, separating myths from science and showing you why ignoring the problem could put your health and even your life at risk. And make sure you stay until Chapter 7, because that's where we'll reveal how erectile dysfunction can be the first symptom of heart disease, years before other signs appear. Let's begin. Most men think of erectile dysfunction simply as not being able to get hard. But medically, it's more specific. Erectile dysfunction, ED, is defined as the persistent inability to achieve or maintain an erection firm enough for satisfactory sexual performance. Notice the word persistent. This means occasional difficulties don't count. Every man experiences temporary failure due to stress, fatigue, or even alcohol. True ED is when the problem occurs regularly, lasting for weeks or months. Now let's clear up a few myths. Myth 1, ED only happens to older men. False. While age increases risk, young men can also experience ED due to stress, anxiety, or medical issues. Myth 2, ED is always psychological. False. Studies show that most cases in men over 40 are linked to organic causes, such as cardiovascular disease, diabetes, or hormonal imbalances. Myth 3, if you have ED, you've lost your masculinity. False. ED is a medical condition, not a reflection of manhood. Understanding what ED truly is and what it isn't is the first step in breaking the stigma and treating it effectively. In the next chapter, we'll uncover the different types of erectile dysfunction and how doctors classify them to better understand each case. Doctors divide erectile dysfunction into two main categories: organic and psychogenic. Organic ED. This is caused by physical problems that interfere with blood flow, nerves, or hormones. Common causes include cardiovascular disease, blocked arteries, hypertension, diabetes, damages both nerves and blood vessels, hormonal disorders, low testosterone, thyroid imbalances, neurological conditions, spinal cord injuries, Parkinson's disease. Organic ED is more common in men over 40, and it often develops gradually. Psychogenic ED. This is caused by psychological or emotional issues. Common triggers are stress, performance anxiety, or depression, relationship problems, trauma, or guilt related to sex. Psychogenic ED often appears suddenly, and men with this type may still have normal nighttime or morning erections, a key diagnostic clue. In reality, many men have a mixed form, where both organic and psychogenic factors combine. For example, a man with diabetes may also suffer from anxiety about performance, making the condition worse. In the next chapter, we'll look at the most important risk factors that make ED more likely, and why this condition is becoming a global health epidemic. Erectile dysfunction doesn't happen by chance. It's usually the result of specific risk factors that damage circulation, nerves, or hormonal balance. The most common include age. Risk rises sharply after 40, with nearly half of men affected. Diabetes. High blood sugar damages nerves and blood vessels. Hypertension. Constant high blood pressure stiffens arteries, reducing blood flow. Obesity. Excess fat lowers testosterone and increases vascular problems. Smoking and alcohol. Both weaken circulation and nerve function. Depression and anxiety. Mental health directly affects performance. Low education and unemployment. Studies show social and economic factors also increase ED risk. What's alarming is that these risk factors are becoming more common worldwide. That's why doctors now call ED a public health issue, not just a private bedroom problem, but what's actually happening inside the body when these risk factors take control. In the next chapter, we'll explore the mechanisms behind ED, the science of why erections fail. To understand erectile dysfunction, we need to see how the body's systems interact. Three main mechanisms can fail. Circulatory problems. An erection depends on strong blood flow. If arteries are narrowed by atherosclerosis, plaque buildup, blood cannot fill the penis properly. This is why ED is often the first sign of cardiovascular disease. Nerve-damaged nerves carry signals from the brain to the penis. Conditions like diabetes, spinal cord injuries, or surgery on the prostate can damage these nerves, breaking the communication chain. Hormonal imbalance. Low testosterone reduces libido and weakens nitric oxide production, which is essential for erections. Thyroid and pituitary disorders can also interfere with hormonal balance. These three systems, circulation, nerves, and hormones, must work together in perfect harmony. When just one is disrupted, the entire process collapses. But how do doctors confirm which factor is causing ED in each man? In the next chapter, we'll explore the medical evaluation and diagnostic tools that reveal the truth. When a man seeks medical help for erectile dysfunction, the goal isn't just to confirm the problem, it's to discover why it's happening. Doctors use several steps: medical history questions about lifestyle, stress, medical conditions, and medications. This often reveals hidden risk factors like smoking, diabetes, or depression. Physical examination, checking blood pressure, body mass index, and genital health to look for physical signs of vascular or hormonal problems. Blood tests, measuring levels of testosterone, cholesterol, blood sugar, and thyroid hormones. These tests uncover metabolic or endocrine causes. Specialized tests, nocturnal penile tumescence test, determines if erections occur during sleep, helping distinguish organic versus psychogenic ED. Doppler ultrasound evaluates blood flow in the penile arteries. This detailed evaluation allows doctors to identify the root cause and choose the most effective treatment instead of guessing. But once diagnosed, how do we treat ED? In the next chapter, we'll explore the range of treatments available, from pills to surgery. Treatment for erectile dysfunction depends on the cause, severity, and patient preference. Doctors usually follow a step-by-step approach. Lifestyle changes, stopping smoking, reducing alcohol, losing weight, exercising, and managing stress can significantly improve erections. Oral medications, PDE5 inhibitors, sildenafil, Viagra, tadalafil, Cialis, vardenafil, Levitra are the first-line treatment. They boost the natural erection process by enhancing blood flow. Hormonal therapy. If low testosterone is the main cause, testosterone replacement therapy can restore libido and help erections. Devices. Vacuum erection pumps create negative pressure to draw blood into the penis. Effective, but less spontaneous. Injections. Drugs like alprostadil can be injected directly into the penis, triggering an erection within minutes. Surgery. For severe or resistant cases, penile implants provide a permanent solution. These devices allow men to control when and how long they have an erection. Treatment is not one size fits all. The best choice depends on the cause of ED and the patient's lifestyle. But beyond treatment, ED carries a bigger message. It can reveal hidden health dangers. In the next chapter, we'll explore how ED is often the earliest warning sign of cardiovascular disease. One of the most important discoveries in modern medicine is that erectile dysfunction is not just a sexual problem, it's often the first sign of cardiovascular disease. Here's why. The arteries in the penis are much smaller than those in the heart. If plaque buildup, atherosclerosis, is blocking blood flow, it will usually show up in the penis first. In fact, many men experience ED 3 to 5 years before they develop symptoms of heart disease. Studies confirm that men with ED have a significantly higher risk of heart attacks, strokes, peripheral arterial disease. This is why doctors call ED a sentinel symptom. It's the body's early warning system, telling you that your vascular health is in danger. Ignoring ED isn't just risking your sex life. It could mean ignoring the earliest sign of a potentially fatal condition. In the final chapter, we'll bring everything together and show why erectile dysfunction is truly a silent epidemic, and what men can do to break the silence. Erectile dysfunction is far more than a private problem in the bedroom. It's a global health issue. Studies show that nearly half of all men over 40 experience some degree of ED, yet the majority never seek medical help. Shame, stigma, and the belief that it's just a normal part of aging keep millions suffering in silence. But here's the truth. ED is not only treatable, it's preventable. By addressing the root causes like diabetes, hypertension, obesity, smoking, and depression, men can protect both their sexual function and their overall health. Doctors stress that ED should be treated as a vital sign of men's health. Just like checking blood pressure or cholesterol, asking about erections can save lives by revealing hidden cardiovascular risks early. Breaking the silence means recognizing ED for what it really is, a medical condition with deep connections to physical and emotional health, not a mark of weakness. And in our next video, we'll look at all the treatment options compared side by side, from pills to surgery, so you can understand the full spectrum of solutions available today.